Hi, I'm Ashley. I'm a nurse practitioner student. Today we're going to do a lateral injection of the elbow. Up to this point, we have tried NSAIDs and physical therapy for pain relief, and that has not helped, correct?
Correct.
Okay. We're going to go ahead and discuss some of the risks and benefits of the procedure. Benefits include reduction in pain, reduction in inflammation, and increased range of motion for you. Some of the risks would include infection, localized bleeding, weakness of the ligaments, ruptured tendons, nerve damage, tissue damage, osteonecrosis, and osteoporosis. Do you have any questions about those things?
Mm-mm.
Would you still like to go on with the procedure?
Yes, I would, please.
Okay. At this point, we'd also consider contraindications, which would include diabetes, a coagulation disorder, infection of the joint. If the joint was unstable or damaged, we would not proceed. In this case, we will. So I'm going to do my initial assessment. I'm going to feel for the humerus, the radius and ulna, the medial epicondyle, lateral epicondyle where we'll do our injection, and the olecranon. I'm going to assess for range of motion, so we'll have flexion, extension, pronation, supination. I'm going to place you in supine position. I'm going to have you flex your elbow at a 45-degree angle with your hand pronated. And we'll go ahead and proceed with the injection. I'm going to palpate for the point of maximal tenderness, and I'm going to go ahead and mark that spot, as I'm also palpating the lateral epicondyle, and mark the spot with a pin. I'm going to wear non-sterile gloves for this. We're going to cleanse our site with betadine solution. We're going to draw up 40 milligrams of depomedrol and lidocaine. We could draw them up separately, but for the purpose of the video, we're going to draw them up as one injection in a 3 ml syringe. And we're going to inject at a 90-degree angle into the joint. And I'm looking for proper placement, which I have here. I'm going to pull back to make sure that we're not in any blood vessels, and then inject. I'm going to apply a Band-Aid for a dressing. That can stay on for 24 hours. You want to rest the joint for 24 hours. You can ice for pain control. You can also use over-the-counter NSAIDs such as Tylenol or ibuprofen. The pain could persist for up to 36 hours after the injection. You won't want to do any heavy lifting or going shopping, carrying shopping bags for 10 days. And then you'll also want to watch for some signs and symptoms of infection, which would include redness, swelling, and drainage from the joint. Do you have any questions about that?
Mm-mm.
Okay.